Hello ladies and welcome to my channel. My name is Aisha, aka Nurse Aisha. So for those of you that are new to my channel, welcome to our female to female conversations. For those of you that have been with me for a while, welcome back and thank you for supporting my work. So as you saw in the intro video, I'm going to talk about when I featured in this amazing magazine for Swedish Association for Diabetes Care, Swedish Nurses Association for Diabetes Care. So this magazine is given out 3 times a year, and this was their 2nd edition, and I made the cover. So we talked about diabetes care in a cultural perspective. This was a very important subject to bring because it was a few months ago around June, and it was coming towards Ramadan, which is a big holiday. So it wasn't just about cultural perspective, it was also religious perspective. So diabetes care from a cultural perspective as well as religious perspective. So I featured on page 8 and I answered 3 questions that were very important to talk about how I deal with different barriers when it comes to caring for diabetes type 2 patients that I worked with when it comes to language barriers or other barriers that come with people from another country and that have another culture other than the Swedish culture. So let's get into it. So the first question that I was asked was, let me read it. So unfortunately, the magazine is only in Swedish and it's for us nurses. It's basically for us nurses to discuss different topics that we can help each other care for our patients better. I don't think that this comes out for patients. I think there should be one for patients because this is really good information for everyone, not just for us nurses, but also for patients. So the first question was, what are the challenges that you face during your follow-ups with patients, diabetes patients from another country? So basically, another country other than Sweden. Obviously, for those of you that don't know, I'm a nurse. I work with diabetes. I have worked with diabetes, and I'm based here in Stockholm, Sweden. So this is basically about patients that don't have the Swedish culture, the Swedish language, and what are basically the barriers or the challenges that I might face taking care of these patients. So the first challenge, obviously, that I have is the language barrier. Language barriers are very common here. So when I meet patients that don't speak the Swedish language, already there is a problem. By law, we're obligated to offer a translator. But obviously, with translation, there's a lot of information that we can miss. Something where we face more than just a language barrier. So when you offer a translator, it's not just them translating what I said, but they could be a lot of information that is missed in between me, what I said, the nurse, and the translator, so the noise in between. There's a lot of information that can get lost in translation, basically. But that is the main barrier and the main challenge that I have, meeting patients from other countries that do not speak the Swedish language. So, the second question that I was asked is how I work patient-centered or person-centered care for these patients. Now, personally, I always try to meet people where they are. So what I usually do is that I make sure that I get to know my patient. If my patient is highly educated, I will try to give them information so that information and tools that they can use in their everyday care for their diabetes type 2. But if the patient is, for instance, illiterate and they do not have both the language and they don't have any type of education, they cannot read and write, that will also be a challenge. So what I do is I make sure that I get to know my patient and create a personalized care for my patient. That's what I do personally with my patients, and I think many of us as nurses try to do that. That is the best way to tackle any type of barrier. Just ask questions about them, get to know what kind of tools they have, if they have access to anything outside of my office, how they move, if they move. When I say move, I mean exercise, what type of food they like, which culture they come from, and what type of food they eat there, so that we can begin there. So if I have a patient in front of me and their main meal usually is rice, so we talk about carbohydrates and minimizing the amount of carbohydrates that they eat, for instance. So that is how I tackle the situation of personalized care. The last question that I was asked was, what tools or material do you use, or rather, what tools or material do you lack in your work? So when I thought about that question, I went back to the first question and the language barrier. And I thought about having other communication tools so that we can tackle the barrier of language. So when I work with patients that don't have the language, I use a lot of illustrations and pictures, and in this day and age, videos. So I would like some type of communication tool to use with my patients. So let's say that my patient speaks Somali. I would love to be able to have a pre-recorded video in that person's language discussing diabetes type 2 in their language to begin with, so that they already have that information. And after that is done, we can further then, maybe using a physical translator, discuss what type of risk factors they face or how they're going to treat this. So that is something that I would love to incorporate in my work. Even when I'm not working with diabetes patients, that is something that would enhance and better the quality of care for many patients that we need in our daily work as nurses. Those were the 3 questions that I answered, but this magazine is filled with a lot of really good topics that I found interesting. And one of them was diabetes from a multicultural perspective. It's a good article that was that also featured here, with a lot of references to really good articles that are in English talking about the multicultural perspective, and I will try and link them in the description box down below. Another topic that I read about in this magazine was celebrating Ramadan with diabetes. This is also a topic that is very important to us as diabetes nurses, as we face this every year during Ramadan. It's a 30-day fast, which is really draining for the body and not the less for diabetes patients. So every year we try to talk to our patients how they can try and manage their diabetes during Ramadan. And some of them, unfortunately, cannot fast. Many of my patients cannot fast. I cannot recommend some of my patients to fast because it's dangerous for them and their disease. So This is a topic that we constantly discuss, Ramadan and diabetes. Obviously, I have to say that this magazine is not only about diabetes type 2, it's about diabetes care. So this is diabetes type 1 and type 2, but I work specifically with diabetes type 2 patients. So this is a good read, and I was very privileged to be part of this amazing work. I want to thank my colleague Kaya that interviewed me for this magazine. Thank you guys for watching. I'll see you in my next video. Thank you.